The question is, can something be done beyond contact tracing? And specifically, the person is asking for mass testing
in the various districts of the park.
You see, all of this work that you do, you have to work within a certain constraint. It is not true that there is an unlimited stock of testing kits available the world over. We have done very well as a country from our initial 10,000 target to procure, make available, and test. The last number I saw, over 120,000 people. I think the president will give us an update later today on how many we have tested, at least as at now, because I saw Professor Ampofo and his team joining us with the latest statistics to go into it. Precisely because you don't have, for example, 30 million test kits available currently for you to say you are doing mass testing everywhere. So what you have, you test what we call at-risk populations. And so far, the science has led us right. In testing the at-risk populations, that are people who are most likely to get it first, i.e. the contacts of other persons who have gotten it, you begin to get a database of the most likely people to be infected. Now, the public health experts, the infectious disease experts, the epidemiologists who we've been working with started saying this over a month ago, that the general surveillance that was being preached, whether by the WHO or by the Western countries, etc., had gaps. And that is why they said, do the enhanced tracing of at-risk populations, not even mass testing. You remember at some point there was a conversation
about
that
mass testing.
We should do compulsory testing or mass testing. And they explained that no, you balance with the resources that are even available on the world stage now. Every 2 weeks or so, DHL flights flying in test kits into the country, etc., how much you're able to procure. And you focus on the at-risk populations. And that is what is giving us these numbers currently. Today, in Europe, in parts of America, they are now beginning to talk about contact tracing. I think just yesterday, if you observed, and tonight in Boris Johnson's address, they are now saying that from the end of this month, they will be doing the mandatory quarantine that Ghana did from about the 28th or so of, 26th of last month.
For those who are coming into the country. So
I beg of our colleagues to trust the epidemiologists and the infectious disease experts whose advice we are taking and we are working with. Their advice